Well, let's return now to a story that we've been covering over the last few weeks, and that is the state of Gauteng hospitals. The latest red flag is the cancellation of over 780 operations at the Charlotte Maxeke Hospital. This hospital in Johannesburg was devastated by fire last April, and it struggled to get back on its feet. And I'm joined now by the DA's Gauteng Health spokesperson and member of the Gauteng legislature, Jack Bloom. Good evening, and thank you so much for joining us. So just talk to me about why these ops are being cancelled. Is it simply because the hospital's not up to speed yet following the fire?
Well, it's partly that, but they're short of ICU beds and they're short of ICU nurses. There's the COVID situation as well, but I really think they could have done a lot better because the waiting list for surgery is actually very long now. It's just under 3,000, in fact. And if those operations had gone ahead, I think could have been in a much better position with surgery for especially children. A lot of the operations, 600 operations last year, were for pediatric surgery. I don't know why that's the case. There seems to be a particular problem there, but I mean that's really very distressing. And now the waiting list for surgery, there's about 453 children waiting for surgery. They could have all been done last year if it wasn't for all these cancellations.
So talk to me about the kind of ops. You mentioned pediatric surgery, but I believe there's also quite a lot of orthopedic surgery. Are we talking things like hip replacements?
Well, hip replacements can take as long as 2 or 3 years. But I've been given the official figures from a question I asked in the Gauteng legislature. And in fact, it's considerably worse than that because there's a waiting list to get onto the waiting list. First, you have to see a specialist, and that can take quite a long time. And once you see the specialist, then you put on the waiting list. So I think these official waiting times and waiting lists underestimate the problem and the suffering. You know, if you have to wait 2 to 3 years for a hip op, that's devastating. Or you need cataracts done, and you have to wait 6 months to a year, or you're a little child and you have to wait up to 2 years for an operation. I think they really need to do better. And, part of the problem is indeed because they haven't fully reopened the Charlotte Maxeke Johannesburg Hospital. We're told that that will be done by the end of next year. But I think in the meantime, we need to do special measures, work around the clock, work over weekends, use other hospitals. I think it's unacceptable to have so many people waiting for such a long time on operations and stop all these cancelled operations for whatever reason. It just adds to the problem.
Gauteng Health has issued a release today talking about what they are doing. They say that they're referring patients to other hospitals. They mention a number of hospitals. They also said there's an issue with a shortage of organs for transplant. Obviously, they mentioned what you've spoken about, the ICU and bed shortages. They're also, interestingly, calling for public-private sort of collaborations on these operations, which sounds to me like they're asking private sector hospitals to help out. I want to know if you think that that's actually quite a good idea. Is there anything that you would be doing differently if it was in your hands to solve this problem?
Well, I think that we do need to involve the private sector, and I think that the British National Health, in fact, contracts Netcare to do a lot of their operations. So if a Netcare hospital can do this in Britain, in the national health system, why can't we do it here? You know, I really think this is the way forward, and we need to have big blitzes where doctors work over weekends, we work with private hospitals and cut down these terribly long waiting lists. So, yes, that is the way forward. I'd like to see a lot more movement in that direction.
We know, of course, that, Charlotte Maxeke is just one hospital in distress in Gauteng. And we've had crisis calls from various doctors, Rahima Musa, of course, Dr. Tim de Meyer, and other areas as well. We know that Chris Hani Baragwana ran out of bread. Partly it's to do with the budget, but we also know that there's a lack of skills in terms of understanding how to run massive hospitals. That is part of the problem. However, we've also been promised a comprehensive response from the Health Department to the specific issues here in Gauteng. What is your understanding of where we are in that process? Because I don't see a plan on the table as yet. Perhaps you know more?
Well, the Premier of this province came into office 8 years ago, and he said, quote, that he's going to have an urgent turnaround for the Gauteng Health Department. And that was 8 years ago. I've lost count of the number of times that new plans have been proposed and new heads of department that have left in scandal. And there was supposed to be a major intervention at the beginning of last year. What's happening with this? I think it's time that they put the right people in the right jobs. They're clearly not putting competent people in charge of these hospitals. The CEO of Rahima Musa Hospital should never be there. I mean, can you imagine that her reaction to Dr. Tim de Meyer's appeal was to suspend him? And in fact, the reason he went public with an open letter is because he'd been ignored. And this was the CEO who didn't seem to know that there were pregnant women sleeping on floors in her hospitals. She spent about a third of her time working from home. I got that from information from a question I asked in the legislature. So I think we need clear answers. Doctors are really great distress. Nurses, everybody's feeling the strain, and we're not getting the answers once and for all. What is going to be done to fix our hospitals, do the best with what we've got? We still have scandals. We still have wastage of money. We had the PPE scandal. We've got a ghost hospital on the far West Rand that they've spent 700 million rand on, and it's empty as I speak. I mean, just stop the scandals, listen to the Auditor General and fix up that department. That's really what we need to see happening, and no more excuses.
All right, thank you so much for chatting to us this evening. DA's Gauteng Health spokesperson, member of the Gauteng legislature, Jack Bloom there.